Hello guys, so now we shall be discussing regarding the glossopharyngeal nerve. Okay, so glossopharyngeal nerve is your ninth pair of cranial nerve, which is also called as a mixed nerve. Why it is called as mixed nerve? Because both the sensory fibers as well as the motor fibers, both of them are present here. That is why it is called as a mixed nerve. So a topic of discussion would be glossopharyngeal nerve. Glossopharyngeal nerve is also called as your ninth pair of your cranial nerve, right? So this particular glossopharyngeal nerve, as I already told you, that this is called as a mixed nerve. This is called as your mixed nerve. Okay. Now, second important thing you need to know here is that regarding this glossopharyngeal nerve, right? The first important thing I want to tell you is that let us look at the nerve, how it is passing and all. But before that, let me draw some anatomical structures over here. So these anatomical structures are, one is the medulla oblongata. So this particular, and next important thing is that I am only drawing the half part of the medulla oblongata. So this is your medulla oblongata. So this part over here is your medulla oblongata. And this particular structure which I am drawing right now is called as inferior cerebellar peduncle. Okay. Now after this inferior cerebellar peduncle, here the structure which you have is called as olives. So what are these structures? These structures, this structure is called over here as olive. Okay. Now down here there are another few more important structures. For example, here you have got a foramen. Okay, the opening or the foramen that is located over here is called as your jugular foramen. So this particular one over here is called as your jugular foramen. Now, from where does this glossopharyngeal nerve basically arise? Glossopharyngeal nerve arises all the way between the inferior cerebellar peduncle as well as the olives. So where is your inferior cerebellar peduncle? This is your inferior cerebellar peduncle. This is your inferior cerebellar peduncle, and these are your olives. So between your inferior cerebellar peduncle and the olives, the nerve that is coming out is called as your glossopharyngeal nerve. So this glossopharyngeal nerve comes all the way down like this. Okay, so this is your glossopharyngeal nerve which I am drawing, or let me use another color. So this glossopharyngeal nerve comes all the way like this. Okay, and down here there are two important ganglions. So this particular ganglion is called as a superior ganglion, and down here this particular ganglion is called as your inferior ganglion. So superior and inferior ganglion is this one. One is called as a superior ganglion and the other one is called as your inferior ganglion. Okay, and this is your inferior cerebellar peduncle as well as the olives. Now let us look at few important nuclei which are located within this medulla oblongata. Okay, so first of all, let me draw a red color nucleus over here. This red color nucleus is called as Nucleus ambiguus. Okay, next after that, let me draw one green color nucleus. This particular nucleus is called as inferior salivatory nucleus. Okay, and next let us draw a blue color nucleus over here. This particular nucleus is called as your solitary nucleus. And finally another color, the blue here, right, the dark blue, this is called as a spinal nucleus of your trigeminal nerve. Okay, so how many nuclei are there here? We have got 4 important nuclei. So let us write down the names of this nucleus. So this one is called as Nucleus ambiguus. Nucleus ambiguus. The second one is called as your inferior salivatory nucleus. Inferior salivatory nucleus. Okay, next the third one is called as a solitary nucleus. This one over here is called as a solitary nucleus. Okay, the next one is called as a spinal nucleus of your trigeminal nerve. This is called as your spinal nucleus of your trigeminal nerve. Okay, now what is this foramen over here? This foramen over here is called as your jugular foramen. This foramen over here is called as your jugular foramen. Okay, now what are these two ganglia? I already told you this ganglia is called as the superior ganglion superior ganglion, and this one is called as the inferior ganglion. Superior as well as the inferior ganglion over here. Now, next important thing is that here let me draw the middle ear cavity. So this is your middle ear cavity like this. Okay. Now, after this middle ear cavity, let me also draw few more important things. All of you know that we have got trigeminal nerve. Trigeminal nerve has got three branches, V1, V2 and V3. Right. What is this V3 branch called as? V1 branch is called as ophthalmic nerve. V2 branch is called as maxillary nerve and V3 branch is called as mandibular nerve. So let us say that here this branch which I am drawing is called as your V3 branch. Okay. Now from this V3 branch you see another branch that is coming like this. This branch is called as auriculotemporal nerve. Okay. In front of the V3 branch you have got a ganglion like this. This ganglion is called as Otic ganglion. Okay, so what are the structures I have written over here? So this branch is called as V3 and this ganglion is called as Otic ganglion. Otic ganglion, and this is called as your auriculotemporal nerve. Okay, this is called as your auriculotemporal nerve. And obviously you even have got a gland called as parotid gland. So this is your parotid gland. So this gland over here is called as your parotid gland. Okay. So these are some of the structures which you need to know before itself. And apart from this, there is one more structure. Right in front here, let me draw the tongue. Okay. So this is the tongue. Clear? And just beneath the tongue, you know that you have got the bone like this. What is this bone? This bone is called as your hyoid bone. And here you have got a process. This process is called as styloid process. Now I am drawing one muscle over here. This particular muscle is called as your pharyngeus muscle. Right? One of the pharyngeal muscle. It is called one of your pharyngeal muscle. Okay. Now from the styloid process to the pharyngeus, this muscle which you have is called as your stylopharyngeus muscle. So this particular muscle over here is called as your stylopharyngeus muscle over here. Clear? Now let us discuss the things. Let me write it down. First of all, this is your stylopharyngeus. This one is your stylopharyngeus muscle. Okay. And this is your hyoid and this is your tongue. This is your tongue. Now, next important thing you need to know is that you know common carotid artery. Right. So what do you know about that? You know that common carotid artery will divide into internal carotid and external carotid. Let us say this is common carotid. Okay. It is dividing into two important structures. One is called as external carotid. Another one is called as your internal carotid artery. Now at the place of this external carotid artery, you see a swelling. Right. So this particular swelling is called as your carotid sinus. Okay. So this particular swelling over here is called as your carotid sinus. Carotid sinus. And this particular structure which is located in between the two structures, I mean the internal and external carotid, this one over here is called as your carotid body. This is called as your carotid body. So one is called as your carotid sinus, another one is called as your carotid body. Now let us draw the nerves over here. So as I already told you, this is nucleus ambiguus. Now from this nucleus ambiguus, what fibers are coming? So these fibers are called as motor fibers. Complete term is called as branchial motor fibers. So from where are these branchial motor fibers arising? These branchial motor fibers are arising from your nucleus ambiguus. So from your nucleus ambiguus, the fibers which arise are branchial motor fibers arise. Okay. So these branchial motor fibers, if you look at these fibers, these branchial motor fibers, they come in between, they arise in between the olives and the inferior cerebellar peduncle, and they go down like this. Okay. Now from here what is going to happen? From here they come down all the way from the superior ganglion, and then they cross the inferior ganglion, right? And then they come all the way down, and motor fibers, they innervate this muscle, and this is called as your stylopharyngeus muscle. Okay, so they are innervating which muscle? Stylopharyngeus muscle. Next important thing is that these green color fibers which you can see, these are called, the nucleus is called as inferior salivatory nucleus. The fibers which are coming out of this green color nucleus or inferior salivatory nucleus are called as general efferent visceral fibers. What fibers here? General visceral efferent fibers. Efferent are those which are exiting out. Afferent are those which are entering inside, right? So what is the course of these fibers? So these fibers, the general visceral efferent fibers, they start from the inferior salivatory nucleus. Okay, these fibers are descending down again between your olives as well as the inferior cerebellar peduncle. They come along with this branchial motor fibers all the way till they come all the way till your superior ganglion, and from the superior ganglion they descend down till your inferior ganglion. Now from this inferior ganglion, what is going to happen? Now from this inferior ganglion, as the nerve exits out, this nerve now which it is exiting out of the inferior ganglion, right? So this nerve is called as tympanic nerve of Jacobson. So what fibers are these? These are general visceral efferent fibers. These general visceral efferent fibers, as they're exiting out of the inferior ganglion, they exit out as a special nerve called as tympanic nerve of Jacobson. Let me write it down. They exit as tympanic nerve of Jacobson. Tympanic nerve of Jacobson. Now this particular tympanic nerve of Jacobson, what is going to happen? This will enter into your middle ear. Now once after entering into your middle ear, in the middle ear, this will form a plexus. Okay. Now what plexus is this? This plexus is called as tympanic plexus. This is called as your tympanic plexus. So within the middle ear, tympanic plexus is formed. Now once this tympanic plexus is formed, this particular tympanic plexus, from this particular tympanic plexus, you see a nerve that is coming out, right? So this particular nerve is called as lesser pectoral nerve, right? So this lesser pectoral nerve will enter into your otic ganglion. What is this nerve? This nerve is called as lesser pectoral nerve. This lesser pectoral nerve will enter into your otic ganglion. Now once after entering into your otic ganglion, so here it will terminate on postganglionic fibers. These postganglionic fibers, they cross this auriculotemporal nerve and enter into your parotid gland. Okay, what fibers are these? These are your postganglionic fibers. Postganglionic fibers. So what is this nerve over here? This nerve is called as your lesser pectoral nerve, and this lesser pectoral nerve will terminate on the postganglionic fibers, and these postganglionic fibers will innervate your parotid gland. Okay, right. So we are done with nucleus ambiguus, we are done with inferior salivatory nucleus. Now what is this solitary nucleus? From this solitary nucleus, what fibers will come out? These fibers are called as general visceral, not efferent this time. These are called as general visceral efferent fibers. Okay. So what fibers? General visceral efferent fibers. So from the solitary nucleus, the fibers which come out are general visceral efferent fibers. General visceral efferent fibers will come out. Now, from where these general visceral efferent fibers are taking the sensations? See, these general visceral efferent fibers are taking the sensations from the carotid sinus. They even take the sensations from the carotid body. Okay. So, from the carotid sinus and carotid body, you see a nerve that is going up. This nerve is called as carotid sinus nerve. This is called as carotid sinus nerve. Carotid sinus nerve. Okay. Next, not only that, even the taste sensations from the posterior half of your tongue. See, these are the taste sensations from the posterior half of the tongue. So the taste sensations from the posterior half of the tongue are also taken up like this. Okay, and as this is a pseudo unipolar neuron, right? So these carotid sinus nerve, whatever is there, and the sensations, taste sensations from the posterior part of the tongue, these are your efferent fibers. And these fibers which are, peripheral fibers. So next group of fibers, they are ascending up. These are your which fibers? One is called as a peripheral fibers, another one are called as your central fibers. So these central fibers, they enter into your, these central fibers, they all the way enter into your solitary nucleus. Okay. Why are they entering here? Why are they not exiting out? Because these are efferent. Efferent are arriving fibers. They enter inside, they arrive. Okay. So these are the fibers over here. So this is all you need to know regarding the glossopharyngeal nerve, guys. So thank you so much for watching my video. Goodbye.